So now I'd like to introduce Kennedy Geenen, who for the past 6 years has been helping me scribe in clinic, but mainly thinking about sunflower syndrome. And she's going to talk to you about the experience that our folks have had with using the contacts. So Kennedy.
Hi, everybody. I'm Kennedy. Hope you're not tired of contact lenses yet. I'm going to keep talking about them for a few more minutes. So like Dr. Teal said, I'm going to talk about a study that we recently did trying to better understand the overall experience with the contact lenses. So we wanted to better understand if these contact lenses were effective and well tolerated as a treatment option for sunflower syndrome. So we designed a questionnaire that we hosted on an online platform called RedCap, and we emailed the link to the questionnaire to patients of Dr. Cantrell's that had sunflower syndrome and were wearing this contact lens. I sort of think about the questionnaire in 3 distinct parts. So the first part of the questionnaire asked a lot of questions about sunflower syndrome in general, so like the age of the onset of hand-waving episodes, other seizure types, frequency of seizures, that sort of thing. The second part focused more on the contact lenses, so when they started wearing them, how often they were wearing the lenses, things like that. And then the last part of the questionnaire is what I'm going to be focusing on today, which was really, were they effective and could you tolerate wearing them? So we sent the questionnaire to 39 total patients, and we received 19 responses, which amounts to a 48.7% responder rate. 14 questionnaires were completed by the parent of a patient with sunflower syndrome, and 5 were completed by the patient themselves. So those would be patients that are over the age of 18 wearing the lenses. The ages of these patients ranged from 7 to 33 years old. 18 patients had been formally diagnosed with sunflower, meaning one person didn't have a formal diagnosis, but we did ask a lot of questions about hand waving, which we do think is a pretty distinct feature of this epilepsy. So pretty confident that all 19 patients that responded do fall under our definition of sunflower syndrome. The other thing is that 14 respondents were currently taking at least one anti-seizure medication, and 16 had previously failed at least one. So only 2 people had never taken any anti-seizure medications and were using the contact lenses as a first-line therapy. So 13 out of 19 respondents did require some time to adjust to the lenses. So that means about 6 people didn't really feel like they needed to take much time adjusting to them, but 4 people said about within the first week of wearing them, they felt pretty well adjusted. 4 people noted that within the first 2 weeks of wearing them, they felt well adjusted, and then 5 people just noted that they really hadn't adjusted well to them yet. That sort of ranged from one person noted that they just didn't wear them frequently enough to be able to say that they had adjusted to them. 2 people did note, somebody asked earlier, that the contact lenses were too dark for them indoors, so it was difficult for them to go about their day inside and outside because inside was just a little too dark while wearing the contact lenses. And then 2 people just felt that they were too uncomfortable, so they really just hadn't adjusted well to wearing them. And then, like Dr. Cantrell mentioned, these are sort of individually tinted for patients. So 8 people did require adjustments to the actual lens. They needed to send them back to have the tint darker. 1 person needed them lighter, and then 4 people required a change to the fit of the lens when they first started wearing them. So 9 people did not feel that they had any difficulty tolerating the lenses, which is just shy of 50%. But the other 50% did note some difficulty with tolerating the lenses. So 6 people noted some sort of a vision change. Either their color perception was a little off, so they adjusted to the blue, but then colors still seemed just a little different, like orange appeared brown. Like I said earlier, it was just too dark inside. 1 person noted that it was difficult to read the music notes during their music class because the contrast wasn't as bright. So that was an issue for them inside. And then 1 person did note that going from really bright outdoor sun to going inside, that transition was made them feel a little sick, actually. So they had a headache and felt a little nauseous in that transition going from really bright light to indoor light. And then 4 people noted just general discomfort, burning and itching of their eyes, stinging, that sort of a thing, and felt, for some of these people, it was too much to continue wearing the lenses, but other people just sort of noted that it was an annoyance, but wanted to continue wearing them. We really didn't see any relationships between things like age or the use of supplements or things like that that affected whether or not somebody tolerated them. So at this stage, just because it was a small study, at this stage all we really know is that about 50% seem to tolerate them well and about 50% don't. So moving on to the efficacy of the lenses, we asked people to rate the severity of hand waving on a scale from 1 to 10 in artificial light while wearing the contacts and without the contacts. So the blue bars on the chart is the severity of hand waving without contact lenses, and each coupling of the bars here are each individual respondent. So the yellow bars are with contacts, so you can see that several people noted a decrease in the severity of hand waving episodes in artificial light while wearing the contact lenses. The little asterisks here indicate patients that did not notice any change in the severity of hand waving when wearing the contact lenses, but you'll also notice that several of them rated the severity of hand waving in artificial light as a 1 to begin with. So it's possible that those are just patients that don't feel very sensitive to the indoor lighting. So we asked the same question for natural light or sunlight. Several more patients rated this severity a 9 or a 10 without the contact lenses, but we still see, similar to the indoor light, lots of people felt that the severity decreased pretty significantly while wearing the contact lenses. We also asked for just sort of an overall perceived benefit of the lens. So on a scale from 0 to 4, 0 being not beneficial at all, 4 being extremely beneficial. 8 people responded that the contact lenses were extremely beneficial. 3 people noted that they were very beneficial. And only 2 people said that they just really weren't beneficial at all for their child. I know this is a lot of numbers, but I just wanted to share here that 16 of the 19 people provided an estimate of the daily hand-waving episodes. So we asked for the hand-waving episodes without contacts and the number of hand-waving episodes with contacts. And overall, we saw about a 73% decrease in hand-waving episodes while wearing the contact lenses, which is pretty impressive. So again, with this small study, we really couldn't gauge. We did ask people if they were using supplements and things like that. Just not enough people were, and it was just too small of a study to really be able to see any clear relationship. So we don't know if there are any variables that really impact if your child is going to benefit this much, but it was really exciting to see this. So they do appear to be possibly pretty effective and possibly well tolerated as a treatment option for sunflower syndrome. So thank you very much. Please let me know if you have any questions.
Thanks, Kennedy. And based on this, what we're planning to do is with Dr. Cantrell, go to the FDA and ask for what's called an investigational new drug or device to do a similar trial as we did with fenfluramine with the contacts. Currently, these are not reimbursed by insurance, and for a year, it's about $3,000 with the 2 pairs, I believe. And so we're hoping if we can do the trial, show data as good as this, that the FDA would give it as medical indication for medical therapy and then be covered by insurance companies. So if anyone would be interested in participating in that, that's going to be a couple months to get it going because we're going to have to negotiate that with the FDA. But thank you.